Hi again, welcome to my channel. My name is Imani. So as you can tell by the title of this video, today we're going to be talking about what a day in the life is for a veterinary technician. So I'm going to split this up into two parts. The first video is going to be for general practice in a small animal hospital, and then the second video is going to be for emergency medicine. So I worked as a veterinary technician for 5 years. My official title was veterinary assistant because I technically never went to school for the 2 years you have to go to school to be a technician, but I did everything a technician did. So I spent 2 years in general practice, and then I spent 3 years in emergency. I was technically at the same location, the same hospital, but that hospital was transitioning away from general practice and going to emergency medicine, and I just kind of stayed with them through that whole thing. So yeah, let's kind of get into it. Okay, so like I said earlier, this video is only going to be about general practice. So as a veterinary technician, you are going to get there around 30 minutes to an hour before the official opening time for the public. So if you take your first appointments at like 8 a.m., you're probably going to get there at 7 or 7:30. During that time period, you want to turn on all the machines, make sure all the computers are on, make sure everything's working properly. You also want to clean out the exam rooms that the clients, which are the owners, and the patients, which are the little pets, because you know this is small animals, so you're going to see a lot of cats and dogs here, are going to be in. So it should have already been cleaned the night before, but just in case anything was missed, there's like a tuft of hair somewhere in the exam room, you as the technician who got there early, you're supposed to clean it out. So the great part about working in general practice is you know exactly how your day is going to go, at least for the most part, because emergency is where all the surprises are. Once everything is cleaned, you are going to go to the computer, review the entire schedule for the day, and then focus in on the first one, see what they're here for, whether it be vaccines or redoing blood work or like a itchy rash or something, or maybe possibly limping, any number of things. You're going to get the necessary materials, and then you are going to, well, once the receptionist puts them into the exam room, you are going to go in there and you are going to take the history as the technician. So at this point, you're going to ask the client like, hey, how's Fluffy doing today? Ask if they're still eating and drinking all right, if there's been any recent injuries or trauma or any weird like limping or bleeding from any areas. Ask if they've been doing okay at home with potty training, especially for the new puppies or maybe even new kittens. Ask if there's been any changes in the environment, maybe a new animal has entered the house, or maybe they are now around a lot of fireworks if it's 4th of July, and like how they're dealing with that, how they're adjusting. So just overall general history questions. Once you take the full history, you are going to exit the exam room, go to the back, talk to the doctor about everything you did, and then the doctor is going to tell you a game plan, so then the two of you can go in. It honestly depends on if you and the veterinarian go in there at the same time, or if you have to take the patient to the back so you and the veterinarian can do your exam there. Really just depends. If it's a really spicy cat and it just hates to be there, you might want to do it away from the client, because when the client sees that their cat is like hissing and spitting and just hates being there, it really like makes them frazzled. And you don't want to frazzle both the patient and the client, so you might want to separate them. You might also want to separate maybe a really aggressive dog that's owner protective, so if you try to do anything around the dog, it's immediately going to think that you're attacking the owner and going to be even more aggressive. But then you separate and then they're a little bit better. If you do have a really good patient and you can do all the vaccines and all the blood draws in the room, definitely do it. So for example, if a puppy's coming in for vaccines, you're going to go ahead and draw up all the vaccines, and then when you and the doctor walk in the room, he or she will already have vaccines in hand, so you don't have to do anything. And then same with the blood draw. draws already have that material with you, so you can do everything in there. So now we're going to switch gears a little bit. So you have the technicians that do go into exam room and are partnered with the doctor the entire day. And then you have another group of technicians. They're kind of like floaters or like assisted technicians. They're basically all technicians, but the type of job that they have that day is different. So again, they could be called floaters, they could be called back technicians, whatever. But those are the technicians that never go into exam room at all during that day, only stay in the back, help with doing laundry and towels that day, help with cleaning out any kennels or cages. They also help the technicians and the doctors that do come back to the treatment area with any blood draws or holding for any ultrasounds, or maybe holding for any possible x-rays, anything like that. It does really help to have a room technician, and then let's just call them a flow or a back technician, just because you can kind of pass the baton to one technician to the other. They can do whatever they need to, and then the room technician can maybe go into the next room, especially if there's a lot of like stacking on top. It just makes everything a lot more easier. But as a veterinary technician, regardless if you're in general practice or emergency medicine, communication is key. Communication for what type of x-rays we're taking, what we're supposed to be looking for on the ultrasound, or even like what type of blood work we're doing, because different blood work counts for different tubes as well. So communication is super important. But overall, as a veterinarian technician in general practice, it's the most smooth sailing, I'm going to say, of the small animals, simply because you know what your day looks like. You know what should theoretically happen that day, and everything should work smoothly. Emphasis on should, but that's the life as a veterinary technician in general practice. So if there's anything I missed, please put it down in the comments. If I missed a bunch of stuff, I'll go ahead and I'll make another version of this just to make sure I give you guys all the information. But from me, that's what it's like being a general practice veterinary technician. All right, see you guys next time. Don't forget to follow me at Dr. Imani Travels, all one word, on Instagram and TikTok. And if you feel like you like the vibe here and you like some really helpful tips on vet school, travel, or anything else in between, please like this video and subscribe to my channel. Thanks.